a great site is, which I have no relationship to, except that I mention them all the time, is examine.com, which has references to human studies and where there's a lot of efficacy shown, and we'll get into some side effect issues. Can't address quality by brand issues, but thanks for mentioning that. What percentage of males who take Cialis, aka tadalafil, or Viagra for erectile dysfunction get relief from that? Because you mentioned only 3% of erectile issues in males are hormonal in origin. But what percentage are likely to be blood flow related in origin?
So a large percentage are blood flow related. That doesn't mean that the medication will be effective for everyone. If you look at the large percentage are vascular in nature, right? That's the number one cause in as men age. So we know that about 52% of men over the age of 40 will have erectile dysfunction, and that continues to increase as you age. So 50% of 50-year-olds, 60% of 60-year-olds, and so on and so forth. So it's very, very common. And the success rate in the studies is about 60 to 70%. So when you give someone a medication, they will have sustained erections that are sufficient for penetrative intercourse, which is the way we kind of discuss erectile dysfunction in studies and in, with patients, is about 60 to 70%. So not everyone will have success, but not all of that is because the medication doesn't work. Sometimes people are not taking them correctly. Sometimes people need to try different doses. And then there's still this issue of, your brain is still active. And so if you're having anxiety or you're having other issues or stress in your life, that can have an effect on your ability to create an erection. So there's lots of factors that go into it. But generally speaking, they are effective and they do work quite well and they're tolerated pretty well.